Hey, 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 all my grad nurses and nurses to be out there. Everybody's prepping for this Nclex. So this is your girl, Nurse Pia. I'm back again with another one. Today's Nclex power topic is psychosocial integrity. And this is going to be about 6 to 12% of your Nclex exam, guys. So today we're going to be talking about therapeutic responses, mental health care, and client safety all in one. So let's dive into psychosocial integrity, how to support mental, emotional, and behavioral health the NCLEX way. All right, guys, so we're here at therapeutic communication. So, therapeutic communication is key. You always want to use open ended statements. You want to be supportive and never judgmental. And don't forget, silence is golden. Okay? So, these are just some of the phrases that you'll see being used, or some of the phrases that you want to stay away from, you want to avoid. Okay? Okay, my nurses. So, next topic, safety first, mental health crisis. We all know we're in the phase of mental health crisis right now, so this is a big topic. So, we want to first prioritize, meaning we're looking at suicidal ideations, self harm, hallucinations, delusions, violent behavior. Interventions that you want to be looking for: remove harmful objects, stay with the client, use calm, clear instructions, notify the healthcare team. Safety is the priority in psychiatric care, especially with suicide, self harm, or hallucinations. So, you guys want to stay calm, stay close, and get help. All right, so this slide we are talking common disorders. You want to know the basics. You want to know how to identify common disorders. For schizophrenia, think hallucinations. For depression, it's isolation and hopelessness. So you want to go through this chart. Remember your disorders and remember the key traits. This is how NCLEX likes to throw them out at you, okay? This is very important. Common disorders, know your basics. Okay, nurses, we are moving along. Slide 5. We are now dealing with hallucinations and delusions. Let's break it down. Hallucinations, false sensory. They hear voices, they see visions. Delusions are false beliefs, like paranoia. Things you want to do, validate the feelings. Stay reality focused, okay? Don't go off the hinges, just stay reality focused. Things you don't want to do with the psychiatric patient that's dealing with hallucinations and delusions is argue or reinforce the delusion. The delusion, excuse me. Hallucinations are sensory. Delusions are beliefs. You want to stay calm, stay grounded, and don't challenge the client's reality. It's just going to end up in a fight. Don't do it. All right, so we're on to therapeutic milieu. So we're talking safe, structured environment. We need a daily routine, we need boundaries, we need peer support, and we need supervised activities always. A therapeutic milieu provides structure, safety, and support. Think of it as a healing environment, emotionally and physically. Okay, this is my least favorite topic, grief and loss stages. So we all know these stages so very well. So we're talking number one, denial. Number two, anger. Number three, bargaining. Number four, depression. Number five, acceptance. Know the order. Know the order. Support each stage without rushing the process. That's your takeaway. Okay? You want to support each stage without rushing the process. And NCLEX may ask, what do you do? Okay? Grief is personal. Support the client wherever they are, even if they're not at acceptance yet. Okay, abuse and mandatory reporting. This is very important. Nurses must report child abuse, elder abuse, domestic violence if vulnerable adults. Document objectively. You want to ensure everybody's safety. Refer to social services. Any questions, any doubts, refer. It's okay. Nurses are mandated reporters. If you suspect abuse, act fast, document clearly, and protect the client. All right, we're wrapping it up. So, you all just mastered therapeutic communication, mental health safety, grief and crisis care, and abuse reporting. You just power through psychosocial integrity. The 6 to 12% that's going to be there. You just power through it. Now go use that knowledge to pass the NCLEX and protect your future clients. This is your girl, Nurse Pia. I'm checking out, wrapping up everything with you guys. I'm so proud of everybody that's graduated. I can't wait till you all sit for your NCLEX. If I'm not at the section that you need yet, keep listening. I'll keep pumping out new material, new content. Share, like, follow. I'll be back with more content. You all have a great one.